In the early 90s, we conducted a randomized control research trial to investigate the efficacy of communication group treatment for people living with chronic aphasia. Our results demonstrated that even people living with long-term aphasia showed statistically significant gains in their language and communication skills. But even more importantly, people who received group communication treatment became less isolated, had increased confidence, and began to participate in the community, many for the very first time since their stroke or injury. After witnessing these astonishing improvements, we opened our center, where people with aphasia could receive the many benefits of a supportive community combined with quality treatment. Our goal is to improve the lives of people living with aphasia. This disorder can cause profound social isolation. People lose their jobs or drop out of school. They're unable to access community services and often end up sitting for hours in front of the television. At the Aphasia Center, we provide a lifeline for participating individuals, their families, and friends. We're a community of people who understand, support, encourage, and inspire one another by providing effective treatment and examples of hope and success. The Aphasia Center is a small, nimble organization with global impact. Our programs are evidence-based, and our research has demonstrated that people who attend aphasia group communication treatment can regain the skills and confidence needed to participate in community life once again. A donation to the Aphasia Center of California is leveraged by our track record of reaching healthcare professionals around the world. We were built on a rock-solid foundation of research-based evidence. Our randomized controlled trial was completed before the doors of the Aphasia Center opened. This research demonstrated the efficacy of aphasia group communication treatment. It showed that people living with aphasia, even years after a stroke and after healthcare coverage had ended, could regain the communication skills and confidence needed to participate in community life once again. We're an extremely effective organization. Each year we provide more than 4,000 visits, helping more than 125 families impacted by aphasia. The Aphasia Center uses a variety of metrics to measure success. To determine our success in providing services to people affected by aphasia in the San Francisco Bay Area, we track individual and group program visits, as well as the number of requests for information and referral. To determine our global success in educating and training healthcare professionals, we track our professional presentations and publications. Since 1996, we have provided more than 85 workshops and published more than 35 papers. One common misconception is that aphasia is a rare condition because so few people have heard of it. Yet, almost a third of all stroke survivors are currently living with aphasia. Another misunderstanding is that the Aphasia Center of California only serves people in the San Francisco Bay Area. Many people are unaware of the global impact that our organization is making. The Aphasia Center of California has been an innovator and a disseminator of our philosophy and clinical methods since the 90s. We've helped train thousands of speech-language pathologists and other healthcare professionals in our evidence-based group treatment approach. In addition, there are now a dozen other independent aphasia centers in the U.S. that were inspired by our work. Because of our significant impact on the lives of people living with aphasia, we've received many honors and awards from local, state, and national organizations. One of the biggest challenges for people with aphasia is the lack of public awareness of the disorder. This lack of knowledge can impact the lives of people living with aphasia in many ways. Through misunderstanding of the disorder, which often results in social isolation, through fewer speech-language therapy sessions being authorized by insurers and other third-party payers, and by less research funding for the disorder. We need additional funding to help create Aphasia-Center-of-California type programs in the United States and throughout the world. We continue to publish and present our work so that other healthcare professionals can apply our evidence-based treatment approach. We've written a book detailing our approach and techniques, and we intend to publish more. We want to expand our training program to reach more healthcare professionals who understand the importance of this work and by incorporating our programs and techniques into their own practice. With additional funding, we'd expand our training programs and outreach to a wider array of organizations and businesses to increase access for people with aphasia within their own communities. Our vast experience in providing direct services to people affected by aphasia, coupled with our clinical research expertise, gives us a unique opportunity to inform the present healthcare policy debate. With additional resources, we'd partner with people impacted by aphasia to ensure they are given a voice in future healthcare reform.